Hello viewers, once again welcome to my new lecture. As we have already discussed about the different diseases and different drugs. Uh, so today we will talk about the angina pectoris and its clinical manifestations, pharmacological treatments, and the variety of conditions which are associated with angina pectoris. So come toward the basic definition of angina pectoris. As we know that angina pectoris is a clinical syndrome usually characterized by episodes of pain or pressure in the anterior chest. Generally, it is described as a retrosternal heavy or gripping sensation with radiation to the left arm or neck provoked by exertions and eased with rest or nitrates. Now, the clinical etiology or the causes is usually there is insufficient coronary blood flow, which results in a decreased oxygen supply to meet and increase myocardial demand for oxygen and respond to physical exertion or emotional stress. Come toward the pathophysiology. So I mean that what is the basic mechanisms which is involved in the pathophysiology of angina pectoris. The common cause of angina pectoris is myocardial ischemia. So myocardial ischemia can result from a reduction of coronary blood flow caused by fixed and autonomic epicardial artery stenosis. So arterial stenosis occurs, narrowing of the blood vessels occurs. As a result of there is abnormal constriction or deficient relaxation of the coronary artery. Already I introduced the oxygen carrying capacity of the blood. Now let's see here. So in this sketch you can see the patient who is inflicted by the angina. So that is angina is the type of chest pain, pressure or discomfort. Now this is look at the conditions. So this patient is feeling discomforts and there is chest pains or pressures, especially on the left side. Heart is not receiving enough oxygen due to a narrow coronary artery. Now, what are the factors which are associated with the atypical angina pain? So these are the factors, or you can say these are the aggravating factors which are responsible for atypical angina pain. The first one is physical exertions, and with this increase the myocardial oxygen demands. So what occurs in angina pectoris? There is physical exertions and myocardial infarctions occurs, mean the blood supply toward hearts become decreases. Exposure to colds, for example, there is cause elevation of blood pressure, so BP increase, oxygen demand increase, and whenever, for example, you are eating heavy meal and as well as the stress or any emotion provoking situation. Now come to all the types of angina. So there are different types of angina. So the first one is stable angina. So stable angina, that is the form of angina which is predictable and consistent pain that occurs on the exertion and reduced by rest. So whenever you are in resting conditions, so the pain sensation will be reduced. On exertion, the pain sensations will be increases. And the stable angina is usually triggered by physical exertion when the patient climbs stairs, exercise or walk. So the heart demands more blood and it's harder for the muscle to get enough blood. So when the arteries become narrow, so when there is twisting or you can say narrowing of the blood vessels occur. Beside the physical exercise, other factors such as emotional stress, cold temperature, heavy meals and smoking, so it can also narrow, it will also cause narrowing of the blood vessels, especially bronchial, you can say the vasoconstrictions and trigger angina. Another one is unstable angina, or this is also known as preinfarction angina. In this type of angina, the symptoms occurs more for longer than stable angina. The threshold for the pain is lower and pain may occur at rest. So unstable angina can also be caused by the blood clots that blocks or partially block the heart blood vessels. So it worsens and it is not relieved by rest or usual medication. So if the blood flow doesn't improve, so the heart muscle will be deprived of oxygen and the heart become unable to receive that sufficient quantity of oxygen to fulfill the demand. So it is dangerous and required emergency treatment as required for unstable angina, because in unstable angina, so it is not maintains, so it can't maintain, for example, the symptoms which are occurred, so that is for longer than stable angina. That's why the pain is increased and the pain doesn't record with rest. So an unstable angina, it can be also caused by blood clots. So we have already discussed that it may be partially blocked, or you can say that the heart blood and the heart blood vessels. We have an emergency treatment is required for unstable angina. This is very necessary to treat this condition and emergency. While the third one is silent ischemia. So silent ischemia, or you can say this is ischemia is also, you can say, one of the clinical conditions. And with the oxygen supply to our hearts, you can say when the oxygen supply to our heart decreases, so the blood supply will be automatically decreases. So the objective evidence of ischemia such as electrocardiographic changes with stress test, but the patient reports no symptoms. Come toward the risk factor for atherosclerosis. So as we know that, so in atherosclerosis there is occur the formation of atheroma, plaques formation at the level of, you can say, hardening of the blood vessels occurs. Now the risk factors which are already given here, so you can see the family history of premature coronary artery disease, diabetes, in case of diabetes, when there is diabetes mellitus, or you can say systemic hypertension. Cigarette smoking is the main risking factors for the atherosclerosis. Hypercholesterolemia, this is also another risk factor for which is responsible for atherosclerosis, while the other is obesity, so it increases the level of lipoprotein, fibrinogens and triglycerides. Now come toward the clinical manifestation of angina. So it may produce pain, severity and severity from the feeling of indigestion to choking, and the retrosternal area radiate to neck, jaws, shoulders and inner aspects of the upper arms. Feeling of weakness or numbness in the arms, wrist and the hands. Shortness of breath. So these are the clinical manifestation which I have quoted. So one is the pain condition. So the pain is ultimately increased with the severity, especially in case of feelings of indigestions to choking in the retrosternal area, radiate to neck, jaws and shoulder and many more. As well as there is sort of, you can say, feeling of weakness or numbness in the arms, wrist and the hands, and shortness of breath. So these are the clear sign symptoms. Another clinical manifestations, that is pallors, diaporesis occurs. So in diaporesis, there is sweat gland secretions, perspirations, as well as the dizziness or lightness, nausea and vomiting. So these are the clinical manifestations which are reported by the different patients. Let's see here the diagnostic procedures or diagnostic findings, how we can find out, how we can diagnose the patients, often made by evaluating the clinical manifestation of ischemia in the, you can say, the patient history. So for examples, the 12-lead ECG electrocardiograms and the blood laboratory value help in making diagnosis. So you will have to check the C-reactive protein CRP as a marker for the inflammation of vascular endothelium, which caused by coronary artery disease. So I think this is very easy to understand. So these are the segments you get sometimes. So you are observing in the ECG. So these are the segments. This is called P, Q, R, S, T. So these are the segments, especially whenever you are going to perform electrocardiograms, ECG for patients. You can see this is electrocardiograms normal. So this these values, this is the graphical, you can say, representation. You can see the peaks. So this show that there is normal heart beatings. While in the second case, the heartbeat is going to increase. This is called tachycardia. So whenever, for example, if a patient whose blood pressure is not normal, or you can say in case of high blood pressures, so the heartbeat had become abnormals. So whenever there is past heartbeat, so its ECG will be like this, like electrocardiogram. So these are the peaks. You can say there is a big difference between normal heartbeat, and you can see the fluctuation, the crest and troughs which are formed. Another one is slow heartbeats. Now these are the you can say this is another classical representation of the segments ECG electrocardiograms which are performed for the patients. So in case of slow heartbeat, so you can see, so there is a big difference between normal, fast and slow heartbeats. So you can see here, these are the different segments, or you can say fluctuations, trough and crest. So and crest, so they are formed. In case of irregular heartbeat, so the ECG will be look like this, electrocardiogram. So you can see, so I means that all these graphical representations, they are different from one another. This is T view, this is QRS complex, and these are P view. So P view mean it represents the activation of the atria, while the QRS complex, it represents the activation of the ventricles, while the T view represents the recovery view. So this is very easy to understand. You can see all this graphical representation, that these are the segments which are formed whenever you are going to perform ECG electrocardiogram. Okay, so these are the diagnostic finding in an elevated blood level of homocysteine and amino acid proposed as an independent risk factor for cardiovascular disease, but no studies supported the relationship between the elevation of the homocysteines, or you can say arteriosclerosis. Now come toward the medical management for the patient with angina pectoris. For example, a patient having angina pectoris, so how we can manage. These are the medical management, how we can manage it. So let's see here. The objective is to decrease the oxygen demand of the myocardiums and to increase the oxygen supply. So as we know that myocardium, which is the strongest muscle of the heart, so myocardial contractility, it means the heart have the capability to pump the blood to all parts of the body. So in this case, the oxygen demand for the myocardiums, so that is decrease and increase the oxygen supply. For example, nitroglycerin can be administered in order to reduce the myocardial oxygen consumptions. The second one is beta-adrenergic blocking agent. So these are the drugs which are used to treat, or you can say you can easily diagnose such a type of emergency conditions. So beta-adrenergic blocking agents, so these are include propranolols, metoprolol, and atenolols. So as we know, these are antihypertensive agents. So they are appear to reduce the myocardial oxygen consumption, results in a reduction in the heart rate, decrease blood pressure, and reduce the myocardial contractility. The third category is calcium channel blocking agent or calcium channel blockers. So there are some drugs that can decrease the sinoarterial nodes. So there are two nodes. One is sinoarterial node, the second one is SA node, and while the second one is SA node and AV nodes, atrioventricular node. So most of these agents or these drugs decrease the sinoarterial node automaticity and nodes conduction, resulting in slower the heart rates. The fourth one is antiplatelet and anticoagulant medications. So the best, the classicals, one of the classical example, that is aspirin. So aspirin is ethyl salicylic acid, so it can prevent the platelet activation and it can reduce the incidence of myocardial infarction and death with CAD, coronary artery disease. Now another thing is heparin. So heparin is it come under the category of anticoagulant, so it can prevent the formation of new blood clots. So in order to avoid the clot formations, so in the blood vessels, so these heparins can be used, aspirin and heparins. So I mean, this is actually the pharmacotherapy for this disease. Okay, now oxygen administrations as usually initiated at the onset of chest pain to increase the amount of oxygen delivered to the myocardium and to decrease the pain. How the angina pectoris can be prevented. So these are the preventions, or you can say precautionary measurements. So self-care action plans, changing habits, it should be adopted. So first of all, you will have to stop the smoking and then increase the level of exercise. You should do proper exercise and cut down on fatty foods. So avoid the fatty foods and eat more oats, which decrease the cholesterol. So especially you can focus on the fiber diet. So it will ultimately, you can say, boost up your blood circulation. Lose weight. If your doctor thinks you are overweight, so make sure your blood pressure is not high by regular checks. So consider another method of contraceptives if you take pill. Thank you so much for watching these presentations, especially on angina pectoris. So if you have any question regarding this lecture, so I'm always available for your services. So before watching this lecture, so please kindly subscribe my channel, watch it, like it, and also press the bell icon for my upcoming lectures. Thank you so much, my viewers and my students. Wish you all the best.